Welcome to my weekly meeting. Today we're going to be talking about photorejuvenation treatments. And this, of course, is sponsored by Derme&Co, but it is presented by Platinum Equipment, which is actually our division that is responsible for training and implementing procedures, protocols, and of course, helping you to be satisfied with whatever device you get from us. So without further ado, I'm going to be scrolling back and forth, so here we go. Derme&Co, as I've mentioned many times, we are manufacturers and suppliers of many things. Some of them you may be familiar with. Nelly de Vus, the brand originally from Belgium. Druid Love and Druid, the laboratory, manufacturing of clean products to be retailed in your establishment. Alaska, the brand that is responsible for manufacturing supplies and miscellaneous materials for those that do waxing, and Europe Lab, our private label division, for those of you interested in developing your own brand. But as I mentioned, this particular seminar is sponsored by Platinum, which is our equipment division. So I'm going to go through quite a few things today, but some of the things I want you to consider is really the way you actually work with your clients in evaluation. If you are deciding to get into medical aesthetics, you want to consider utilizing tools that actually do a lot of the work for you. So as I'm scrolling through these images and showing you the image with the Visia machine, which is an analyzing device, this will highlight some of the issues a person may have in terms of needs for treatment. Some of it you may be able to correct by just using skincare products. Some of it you can correct doing services. But as this is an example where we have somebody that has technically a stage of rosacea, which may be genetically predisposed or not, we are looking here at the blue area, which we call the mask area, of where the capillaries are more present and closer to the surface of the skin. So if we were emphasizing treatments or protocols or home care, the whole establishing of where the baseline is for that individual can be found in these particular pictures that I'm showing you. So if you are interested in understanding more about how this device works and how it can benefit you in your establishment, feel free to contact our 1-800 number so we can give you or send you more information regarding the Visia. So the platform itself is really excellent because when we are talking about certain conditions and we're looking at normal skin, most people that are coming into an esthetician would be more critical of things like, I have blackheads, my pores are large, my skin is dry, oily, it's perfectly fine, I have wrinkles, so on and so forth. But quite frankly, most of the time, the objective in treatment should be to actually change something. So if the client can't actually see what's going on with their skin, as the cliche goes, a picture's worth 1,000 words, here we're highlighting the quantity of pores on the nose as well as the cheek area. Again, this is a mask zone. And we can move this mask around to highlight other areas if we want to really be focused on an area where that person may be concerned about. But the goal ultimately is to change the skin, because in this particular case, when we're talking about pores or follicles, the better word to use, is that how when they are blocked or clogged, therefore with a blackhead or a buildup, you may have the right environment for bacteria to thrive, and therefore you end up with the occasional pimple. And as I mentioned before in my previous lectures, anytime you have 3 or more pimples in an area, we consider that to be a stage of acne. So porphyrins, which is bacteria waste, combined with spots, which can be called brown spots, liver spots, lentigines. There are so many things that when we be talking about. Spots are dependent really on the genetic predisposition of the individual. I'm talking about a specific spot, not the general color of somebody's skin. So if we're talking about individual spots that people want to change, we need to determine in our consultation, when did it start? How long has it been there? Do they bathe in the sun? Do they drive a car, a convertible? All these factors make a big difference with regards to this particular condition. And obviously, if we're going to be doing anything with a device to actually change it, we may want to consider some of their genetic predispositions. This book in English is called Anti-Aging the Cure, written by Menon Pilon. And this will be an excellent adjunct to any facility if you're interested in understanding wellness from a holistic perspective. And the goal of this is when we're talking about body types or body evaluations, we can better understand the client and we can actually give them educational tools and informational tools so they can understand themselves as well. It is just another opportunity for you to understand your clients a little bit better with regards to not only where they may be at that point in their life, but what lies in store for them in the future if they're not addressing some of the weaknesses that are naturally found in each morphology or body type. So the main thing that most people are concerned about in terms of treatments or advanced treatments is about aging. And now I personally love to talk about age management as opposed to anti-aging, because you want to manage your age where you are in your life. You know, if you are talking to a 12-year-old, to them, a 40-year-old person is very old. You talk to a 40-year-old, they'll say, I can't believe time flew so quickly, and I feel like I'm 20 inside the head. So aging is really relative to an individual's psychological state. But we do want to talk about some of the things that actually aggravate the skin itself. And this is where in our consultation, by showing a skin chart, we can talk about some of the things that actually contribute or accelerate to the aging of the skin. There's no doubt that we are going to be affected by our environment. And some of the things you want to highlight is the different layers of the skin, the epidermis, the dermis, and structures within the skin, such as the pigment cells, the melanocytes, as well as the sweat and oil glands, the eccrine and the apocrine glands. So when we're talking about the function of the skin and how it actually works, this will make a difference in the aging factor. And if we talk about how you are going to age internally, which is what we call intrinsic, the consideration here is the genetic component, your hormonal balance or fluctuations, and any weaknesses you may have genetically. These pathologies can be things like diabetes, heart disease, vascular weaknesses in the legs, as an example. If we're doing body treatments, maybe things like varicose veins or varicosities that affect blood flow and the movement of fluids. So in the aging factor, we can see that how externally, when we talk about extrinsic aging, your skin will age if you go into the sun frequently. But even if you don't use the sun, as in bathing, lying on a beach, you are going to age because we are affected by the sun itself. So whether it's daylight or nightlight, there's always some ultraviolet radiation, and that can accelerate the aging of the skin. Keeping in mind that free radicals, or as we call it, reactive oxidative stress, ROS, is really the effect of oxygen on the skin and how it actually affects things like the oils that we produce, which oxidize, becoming blackheads, or just being exposed to radiation in chemical environments such as the pollution in the atmosphere, accelerating the aging of the skin in itself. So in the factor of anti-aging, or for consideration for how the skin is aging, you want to look at the skin intrinsically, and you want to look at the skin extrinsically, the factors that are being affected on the outside. Now, as estheticians, you are able to treat the extrinsic factors quite easily, depending on the protocols you have in play. So I want to go over in this particular lecture some of the things you can choose to do when you're actually working with skincare products. As an example, if you're working extrinsically on the skin, you may want to consider having a basic facial in Nelly Devust. We have an amazing peel called Keratosis, which is an enzyme peel to exfoliate the skin, but also helping to reduce blackhead and their buildup. So within one treatment, you can get a 50 to 70% reduction just from using that particular formula in your protocol. So if we're combining this with services, and we're talking about here about using devices such as our IPL machine, as an example, you might want to prepare the skin for the effects of a more active procedure because you're lifting off some of the buildup that's happening on a daily basis. Again, this is the extrinsic factor. If we're talking about the intrinsic condition or the factors that are influencing that individual, this is where the conversation has to come into play with our clients or our patients, because they have to appreciate that there are things that we can't actually change with regards to aging or the aging of the skin itself. So in that particular case, we talk about how structures within the cell, such as the mitochondrial activity, the telomeres, the DNA structure, which we call the helix strand, how all these things have to be considered if we're talking about the science of skin and of the environment itself. So we can look to the outside and have solutions to affect how the skin is aging externally or extrinsically, but we have to consider the intrinsic factors and how we help to support that system, whether it be through diet, through exercise, and obviously with any tools or products we're using on the skin itself. So free radicals have a direct effect on the actual chromosomes. This is the picture you're actually seeing here. So human beings have 23 pairs of chromosomes. And the ends of the chromosome, there is the telomere, and the telomere is actually more like a tail. And as we age, the telomere starts to break down or fragment. So the aging of the skin itself is related to all these cells we have within the skin. Never mind the skin alone, all cells in the body have the chromosome within it. So if we're talking about the breaking down of the structure itself, of the cell itself, all cells are aging based on external factors, but definitely on the genetic predispositions as well. So hormonally, women will appreciate that how they will have fluctuations hormonally because of their menstrual cycle. And unfortunately, they have a little bit more added stress because the dramatic shift hormonally, which for most women, if in a natural state of being, most women in their mid-40s will start to see the symptoms of hormonal shifting more dramatically. This is not to suggest that males don't also have a hormonal shift that occurs, but it's more aggravated for women, and unfortunately, the symptoms can be quite devastating for those people that are really focused on the visual or the outward self. So estrogen plays a big factor in women. It affects the mitochondria of the cell as well. But when we're talking about the mitochondria specifically, which we also call the powerhouse of the cell, we're talking about energy that actually needs to be burnt by the cell. And if the cell is not getting the right ingredients or the tools or food, if you want to call it that, then it's not able to do its job well. So to reverse the mitochondrial activity, we need to have things that stimulate this particular part of the cell. So we can be using things like peptides or a heat energy or vitamin C as an example. There's many different factors that can influence mitochondrial activity. But free radicals, again, create an issue with regards to how the overall structure itself will age prematurely if it's not being considered. So sun is the most important thing that actually ages the skin, and we want to reverse some of the damage caused by sun. So the fallacy is that how it's sunny inside and I don't wear sunscreen, will it actually age me if I'm a dark-skinned individual? Not as much as if you're light-skinned would be the answer, but when we're talking about sun and how it impacts all of us on the planet, the more exposed you are to the sun, regardless of your skin tone or skin color, which we call a Fitzpatrick, we use a Fitzpatrick scale to determine that, the lighter your skin, the more likely you will have more damage because you don't have the natural sunblock, which is called melanin. You don't have the natural sunblock within your body or your skin. So this will create an opportunity for rays to be more aggressive or to damage your skin further and developing conditions like skin cancer. Here is a great example of a gentleman that actually, we call him the truck driver face because that's literally what he did as an occupation. So you can see on the driving side of his face, which would be his left side, the accelerated aging that's occurred just from ultraviolet damage. Now, not everybody's going to experience this if they're just driving occasionally, but for those of you that are more concerned about sun damage and how it's affecting you, and you do drive a car, I suggest using a visor on your windshield or also on your door side. They have the visors for children as an example, and just put that on to help block some of the UV that's actually coming to your face. And when we talk about stress, how it affects the skin and the body will be important in that how the brain function and just the dynamics of brain activity and the brain being out of balance can accelerate the absorption of nutrients in your digestive system, affect the hormones in your body, cortisol being the stress hormone, creating a significant amount of weight gain in the mid belly, which a lot of people might be having because of the current situation universally. But we also have adrenal fatigue where the adrenal glands on top of the kidneys going out of balance, creating a shift in the hormonal system generally. So anything that we're doing to affect the skin, whether it be with a service and we consider what we're taking into our body, sugar is the number one thing to talk about because the effects of glycation is really just the dehydration, the thinning of the skin, all because of bad eating habits and sugar creating problems for you. So some of these pictures I'm going to show you in the next few slides really have to do with conditions that we have. And of course, we have solutions to affect the skin. So if we're dealing with some of the worst case situations when it comes to rosacea, I do actually recommend starting your procedures with aesthetic services. That means facials and treatments to calm the skin down, to train the client with regards to what the maintenance should be, to change the parameters, and then we can go in with our more invasive devices to really be specific to certain issues the person may have. So when we talk about rosacea, we have to talk about the vascular pathways. We have the three circulatory pathways, arterioles, venules, and the lymphatic circulation, all working together to feed the skin and the cells, but also to drain the waste that the cells would have through their natural cellular function. But also, we don't want to contribute to any weaknesses that may already be there. So this is, again, where you need to just appreciate that when we talk about stages of rosacea, such as the 5 we have listed here, a couple of them we can't really change with devices, and that would be specifically 3, 4, and 5, acne rosacea, rhinophyma, the big swollen nose, and ocular rosacea, where the parasite, the Demodex folliculorum, is the parasite. That's what you see there, that little mite that could be embedded within the follicle, and as a result, very difficult to remove if you're not really addressing it with protocol and products that actually help the situation. So when we talk about changing rosacea and we talk about the first stage of it, where a lot of people just flush a little bit, a lot of individuals, regardless of their genetic predispositions, if they just touch the area where the redness would be in the cheek, as an example in this picture, you will feel that there's warmth in the area. And this is because of the rapid rush of oxyhemoglobin or red blood, highly nutritious, but also attached with the oxygen molecule, creating warmth or heat. It can be aggravated, of course, by spice, alcohol, stress, etc. But as we move into the second stage and we start to see these microcapillaries becoming more superficial, which we call telangiectasias medically, but also known as cuperose aesthetically, these fine capillaries can be treated quite easily with an LED device or with an IPL device or with microcurrents. It just depends on the device that you have available. But with the IPL device, we have multiple platforms on the one device, so you can do many things for that individual. And definitely, if you see a lot of this vascular weakness, you want to be able to reverse this pretty quickly. And we combine it with great home care so that they can maintain their skin. So if you look at the capillaries in a magnification, you'll see that they're actually dilated. And when you look at the third stage of it, you can see the combination of the microcapillaries as well as these papules that are found all over this person's cheek and some of their nose. So it's within the papule itself that you may have a combination of bacterium as well as parasitic activity. In this case here, the Demodex folliculorum, if we're talking about acne rosacea more specifically. So the condition itself, because it is something that is aggravating and irritating to the individual, in your consultation, again, you talk about a condition, and honestly, when people have stage 3, we have to talk about digestive stress, H. pylori being active in the gut. Sometimes if you're working with a physician, They're doing an acid test or an alkaline test, basically a pH test, to make sure that the acid range within the gut itself is in a balanced state, which is 7. And if we're talking about any sort of imbalance internally, until you're actually analyzing and getting the person to focus on where the weaknesses may be, you sometimes have a recurrence of a condition because the solution hasn't really been addressed from the weakest state. And this is just more pictures of what the parasite will look like. Now, hyperpigmentation is a big problem for a lot of people because of radiation and sun damage. But in the consideration, we talk about every square inch or square centimeters of the skin to have thousands of melanocytes, roughly 1 in every 10 cells of the basal germinative layer, which is that layer where you see the melanocyte, which looks like a purple octopus with these tendrils going up. This is a melanocyte, and what the melanocyte is producing is tyrosinase, an enzyme that actually converts to melanin, which is the color we see as brown or brown spot. So if we're talking about an individual that's light skinned, the rate of activity of the melanocyte is determined by their genetic predisposition, whereas somebody with a darker skin will have a heightened state of activity because of their genetic predisposition. But we all have, regardless of our race, we all have the same amount of melanocytes present in the basal germinative layer. It's the rate of activity of that cell that is really relevant. Now, going back to the previous pictures when I talked about rosacea, and now I'm talking about hyperpigmentation. These two colors, red for rosacea and pigmentation, which we recognize for most individuals as a brown or a brownish color, these two colors are known as chromophores when we're talking about any sort of light therapy to do with heat, whether it be with a laser or with an intense pulse light device, the IPL device that we have in platinum. So if we are considering melanocyte cell function and the rate activity of the melanocyte, the more pigment that there is, there's more attraction of heat to these pigments. Therefore, the potential for burning or irritation is more significant if we're dealing with darker skin tones. So the device itself is already user-friendly, but it's also smart in giving you an opportunity to do treatments that are safe and stable without creating irritation or risking damage to the skin in itself. It's just about reevaluating what your knowledge may be with regards to conditions like rosacea and hyperpigmentation. So we do want to encourage those of you that are working with us to sign up for our educational programs or forums, to have virtual training. If you don't have that already or have not been offered that, please feel free to allow us to help you grow by understanding the conditions themselves. So when we talk about the formation of melanin, the melanogenesis of the skin, all human beings produce melanin unless they have been genetically altered, which is they no longer produce melanin, whether it be a condition called vitiligo or albinism, which is they have no pigment whatsoever. But hyperpigmentation, hyper, too much pigment, too much color. So normal pigmentation should give an even tone. Abnormal pigmentation will give spots or blotches of pigment based on what has created the condition. And the formation of melanin can be triggered by all these things I have written here, whether it be with your hormones or testosterone or just the activity of radiation and how it affects your skin. So do consider that when you are doing your consultation with your client and you are using a more invasive procedure, you will have to look at some of these conditions that may affect the condition, because if you're not considering how diet is playing a part or how drugs or medications can affect the skin or hormones, and pregnancy, of course, is a hormonal state as well, how all of these things are triggering the formation of melanin and irregular patterns or patterns, you differentiate between symmetry or non-symmetry. This can have a tremendous impact with the success of your services. And the result is, if somebody, as an example, talking about melasma, which is a hormonal condition, if somebody is having melasma as a condition, and because it's an anti-inflammatory thing, you might actually be better suggesting that we do chemical procedures. And again, we have now the first certified organic chemical peels available in Nelly DeVust. It's found in the BioAcne line. But this might be a better solution to offer your clients with regards to lifting the epidermal pigmentation so that how they can be satisfied with a lighter, more even complexion before they go into something that may be more damaging or irritating to the skin. So this is an example of melasma, right, where we see symmetrical pigmentation. You may not see it too clearly on your end, but there's a lot of pigment on the forehead. There's pigment on the upper lip, which sometimes is actually caused also by depilation or waxing in the upper lip and not using a sunscreen. And we'll also notice that there's pigmentation sometimes around the brow if they're doing threading or waxing and not following it up with a sunscreen and allowing the sunscreen to activate. Therefore, pigmentation sometimes is a problem or starts as a reaction to changing something, but not exactly the change this person's looking for. So any sort of pigmentation that's happening in the body, we need to check full body because, of course, we can use our machines and devices anywhere where there is skin. And the differentiating between birthmarks, of course, and what will be conditions caused by the environment itself. So more and more pictures for you to just appreciate that everybody comes to us because there is an issue that they have with their skin that may be the side effect of something that's been going on or dormant for quite a while internally. And the solution is not always something that you can treat in one time or a single application. So to educate the individual as to a series and what it will do and how long they should be going between the series, as an example, the third picture on the right-hand side, you see a condition called Polkaderma, which is described as polka dots, red and brown dots on the skin. So this is usually a combination of factors such as hormones, such as heat, and of course, we're talking about hot flashes hormonally in menopause, triggering erythema. The more and more stimulation that's happening to the more delicate structures, such as the capillaries, the more and more dilation you'll have there. But we're not changing the hormonal situation if we're using the device. So we have to encourage our clients what to avoid so that how these structures are not being overstimulated. So the goal in our consultation and any treatment we do is to explain, to give them an idea as to what we can do. And of course, if we have devices that are a little bit more affordable, depending on what your business is like, the pictures can be worth 1,000 words as well, because it highlights some of the factors that people would be considering. And for those that can do a little bit more with regards to imaging, this is our imaging device that actually shows you the before and after as well. It's called the Reveal machine. Here you're seeing blackheads. This can be fixed just by using better skincare to remedy the oxidative stress caused by the environment. But, you know, picking is a big problem. And when we're talking about bacterium within the follicle itself that replicates at a very rapid rate, especially now that people are wearing masks, you're contributing to other factors such as spreading or acne vulgaris becoming a problem. Here, you're seeing in the device a little bit of herpes simplex on the upper lip. So the Reveal machine that we have through Platinum as well will give you an outline in terms of hyperpigmentation as well as vascular weaknesses. And this again highlights what we want to do to change the skin. This is about melasma, and these are some of the patterns of melasma that we'll talk about when we come into training with you, and pictures that you normally see with a lot of your clients to change the skin. So when we're talking about inflammation and we're talking melasma being an inflammatory state, it's the overstimulation of melanin caused or triggered by a condition or a situation. Here are good examples of where acne, locally, we talk about brown spots because it's not about pustule or a pimple or bacteria in a local zone. It's about the stimulation of everything within that zone. The melanocytes are found, again, in the basal layer, which goes into the follicle lining. And this means that if there's any stimulation locally, you may end up with a brown spot simply because there's overstimulation in a local area. So that combined with sun exposure, that combined with not using any solutions like a sunscreen that's not heavy and greasy if you have acne, can make a big difference with regards to what you're actually treating. And when we're talking about dermatitic conditions such as eczema or even psoriasis, you have a breaking of the skin, which leads to the absorption of radiation more actively. Therefore, you end up with more hyperpigmentation as a result of this condition. And what you really need to treat here is the autoimmune system, because it's a nervous issue with eczema and psoriasis. And if you're not really helping to address the internal aspects of that individual, all the treatments externally won't necessarily make a difference for that individual. And generally, they're hypersensitive and very irritated easily by stimulating products. So this is where your home care as well as your treatment procedures aesthetically would make a big difference for that individual. Blemishes, discoloration, all these things that people are concerned about, obviously they want them to go away, but it won't necessarily go away in one treatment. So by, again, explaining how things work, why it's important to avoid the sun, why it's important when you are going on medications, you read the side effects of what medications can do, because unfortunately these figuring pictures that I'm showing you, not these, the previous ones, can be quite psychologically stressful to an individual. Age spots or lintogenes that most people are concerned about are things that are usually caused by just radiation. But here are two examples of where habits such as using perfume, which usually has a chemical base, creates a photoreaction, and onychronosis, basically the hyperpigmentation caused by using chemicals. In this case, it's hydroquinone, which is a bleaching agent, but when it's used without a sunscreen, this is the side effect of it, where it looks like a black or a charcoal color, and it's very, very difficult to resolve because of the chemical damage caused by the skin. And to refer to pigmentation is to further educate your consumers with regards to the signs of skin cancer. And you do your clients a great service if you're a medical esthetician by observation and also recording or documenting any signs you see of spots or lumps or bumps, so that how they would have some kind of baseline measure to record what is actually going on with their skin and how it's actually training. So with photorejuvenation treatments, the beauty of these devices is that how, if you're linking to our website, we can definitely be feeding you clients if you need more clients. But you want to be talking to your clients in a way where they understand a little bit more about what it is they're looking for. And this gives you an opportunity to let them help you in charting where they want to go. Sometimes you say something to them with regards to, oh, I see you have a spot, and they're talking about the brown spot, not the pimple, and you're thinking it's the pimple they're talking about. So this makes a big difference with regards to product recommendations. We highlight very simple protocol for conditions so that how people will have a step-by-step format. And if you are working with our lines, we really recommend you use our skincare recommendations page. This not only makes it simpler for your client, but it may also cross-reference to other products they may be interested in and other conditions that they may not address with you, because usually a 1 hour treatment doesn't allow you, or a lot of time for you to have a conversation that is of any depth. And in hyperpigmentation, the same thing is true. We have easy solutions here for people to work with. The main thing in the step-by-step 1, 2 is your cleansing and toning to rebalance the pH. But for people that have hyperpigmentation, especially locally, the exfoliation, which is twice a week for maintenance, but you may actually do the exfoliation more frequently in the first skin cycle or the first month, just to increase cellular turnover. And the formula in step 4, which is called Radiance Cream, is actually containing an active ingredient, which is red algae extract. But this is an excellent tyrosinase inhibitor. In other words, an ingredient that helps to rebalance the way the enzyme produced by the melanocytes is functioning. So you have a progressive lightening of the pigment spots. We have in treatments the oxypeel serum that you can use locally to address hyperpigmentation, and we have the outline in the protocols so you can establish treatment for your client. The results speak for themselves. You see changes within 1, 2, or 3 skin cycles based on how much you're actually doing. So the exfoliant, as I mentioned, combined with the oxypeel serum in treatment as well as home care, and the effects of the radiance cream, which technically can be used as a spot treatment or a general treatment based on the conditions you're looking at. So it's a very light texture. I actually like calling this a serum cream because it's a very light texture and it can be used on dry skin as well as oily skin. In anti-aging, preventative treatments is always about using sunscreen. So we were recognized for our organic sunscreen, the SPF 30, which has a very light almond scent. It is free of any nut components so that we don't have to worry about nut allergies. And it is being approved by the FDA as well as Health and Welfare Canada. But in terms of methods of treatment with regards to the device that we have available, these are the things that most establishments that are doing medical aesthetics would be focused on. Most people are familiar with retinols, alpha hydroxy and beta hydroxy acids, kojic acid, and hydroquinone, as I mentioned a moment ago, being the key chemical component when we're talking about hyperpigmentation. So with the machines that are available on the marketplace, the device is costly depending on what you're choosing to do. A lot of estheticians have been using microdermabrasion for the last 30 years, but it is a superficial treatment, much like exfoliating with a gommage, and it could be done more aggressively based on the thickness of the epidermis. I wouldn't recommend microdermabrasion of any depth on a very thin, fragile skin, as in stages of rosacea, as an example. And with regards to chemical peels, the TCA, tetrachloric acid, when we're talking about what is available on the market, the peels that we have available, which is a salicylic and an alpha hydroxy acid that are organically certified, they do have a base of aloe, so it's an anti-inflammatory. So this is an excellent consideration if you want to do things that are more superficial to change the skin, especially when you're dealing with more inflammatory conditions, such as melasma, as an example. But it would also work with somebody that is very sensitive but is concerned about fine lines or wrinkles. So we want to make sure that your cosmeceuticals, if you're working with things that are very active getting into the skin, that they are going to work to actively change the cell structure, and our lab in itself has been proven to be successful. But here's a good example of where devices start to change the skin before and after. And because you have an aggressive treatment in terms of accelerating the change of the skin, the objective is always to get the client to where they want to go. And this is where we come to our fantastic IPL 360, a painless technology where we consider the skin tone of the individual, which we call Fitzpatrick, and the machine itself is programmed to recognize the limits it needs to have when we're talking about the penetration of the light wavelength getting into the skin. So here, when we look at the rainbow of colors here, from purple to red, you'll see numbers above each color, and these are nanometers, but basically the wavelength of light, just like the sunlight has all of these full spectrum, it has all of these wavelengths. What we're doing is isolating a wavelength of light when we do a treatment to affect a specific condition. So when we're using the handpieces, we have a facial handpiece and we have a body handpiece. You will be using gel as a conductor, but also as a cooling agent, depending on what type of treatment you're actually doing. But it'll also allow you to see exactly where you were. So it allows you to recognize your movements and your patterns as well. It's a painless technology, and we have the penetration of the light because of the prism. We're using a crystal. And as it penetrates into the skin, the machine itself bypasses the nerve endings in the skin. Therefore, we don't create any irritation to the nerve endings, and you don't feel any pain as a result of that. So in a series of treatments, in this case here, where we see after the first treatment, and then 6 months later, you may be having a series of treatments where you see somebody for a specific condition, perhaps in a week or 2 weeks. We're talking about perhaps capillaries or hyperpigmentation. But in anti-aging, if we're doing a photorejuvenation treatment, we might see that person once a month, like if we were doing a regular facial, but we'll be using the protocol of the machine instead of doing a massage, as an example. Or you could do a massage and then do the treatment after. But after a few treatments, when it comes to the pigmentation, we can see a better rebalancing of the skin's tone. And everything is dependent on the client being compliant with avoiding the sun or using sunscreen as well during the course of the treatments and after the treatments. You're not going to invest in a Mercedes and not go to the right mechanic, I hope. So this is the same thing here with using the device. If you're going to be doing things to accelerate the change of the skin, you want to make sure that you're combining the right protocols and home care so that you maximize the result of the treatment. So excellent pictures to show the before and after with hyperpigmentation. And the beauty of these devices is that when we're talking about any part of the face or the body, we can always be incorporating treatments in the space of time that we have that individual. So if we're doing a face as an example, and we have enough time to do the hands with spot treatments, this encourages you to actually build multiple components within the one treatment time so you can maximize the results. When you do skin rejuvenation as an example, you are softening the wrinkles, but if you take note of some of the other things that are actually visible here, such as the pore size and just the overall brightening of the skin and the reduction of pigmentation and scars, all of these things are to be considered when we are changing the skin. So in here, we have stage 1 rosacea, where we can see that how the before and after is quite significant. The evolution of the structure of the capillaries themselves is ongoing because, of course, we have to deal with heart function. So we remind our clients that how these treatments can last a fairly long time, but they may need to be readdressed at certain points of time, maybe a year, maybe 2 years or longer, depending on what they're doing to look after their bodies or their skin. So we don't just do the treatments and simply say, that's it, we're done. We do the treatments and encourage them to have more diligence when it comes to maintaining what they have actually had done. So the treatments, great results before and after. And the combination of changing the overall appearance of the skin allows for a brighter, more youthful complexion. So whenever we're doing our treatments for acne, we're going to be using the blue wavelength. The machine is going to program it so that you're using the blue wavelength, so you're killing any P. acnes bacterium that's within the follicle. But this will also help to reduce some of the scar tissue, and the overall texture of the skin will be greatly improved. So if you are doing our organic line, the organic certified organic Nelly bioacne, then you are going to be able to combine products with home care with the services so you can accelerate the results for these individuals. Also, the handpiece for body, which can be used for any part of the body, face, back, chest, arms, legs, bikini area. The hair reduction in terms of the cycle of hair growth, anagen, catagen, and telogen stage needs to be explained so people will appreciate what you're doing that is temporary in terms of reduction and what is more difficult to challenge, such as in the case of when we're dealing with hormones. Now, this particular image here that you're looking at is actually caused by hormonal changes if this is a female. You don't know whether it's a male or female. So let's make an assumption that this is a female individual where there's a bit of hair growth on the chin area. If the hormone is out of balance internally, and it could be an endocrine disorder, or it could be a high level of progesterone and testosterone, and maybe polycystic ovaries. So many different possibilities here with regard to why the hair is actually growing. What we need to address is that how the cycle of hair growth is something that is very active in this area. And when we're looking at about 1,000 follicles per square inch and the opportunity for hair to actually become more dense, more thick, more difficult to actually remove or reduce, the explanation here is worth 1,000 words in your consultation. A picture is worth 1,000 words, because what we're talking about is how you can change the density of the hair, but not necessarily get 100% completely of the hair. So you might get to the point where you just need to tweeze 1 or 2 hairs, but it's possible to go to a point where you have an insignificant amount of hair growth. So this is where we talk about semi-permanent hair reduction, not permanent hair reduction, semi-permanent. So no disclaimers other than when you have expert advice, you need to make sure that how the client is drinking lots of water, you're monitoring your hormones, or the doctor is monitoring their hormones, you're using sunscreen, you are protecting the area, whether it be with clothing or with a hat, reapplying your sunscreen if you're outside all day long. Try to watch your stress if we're talking about conditions that are affected by stress, and use a light sunscreen or a mineral makeup so you're not contributing to any sort of oils, which creates photoreactions on the skin, sometimes burns the skin, and increase your vitamin B intake to help with better balance. And of course, we have the skincare lines to balance your skin. So just to review these quickly here, the upper left-hand side, which is our organic anti-aging line, will have a nice straightforward set of SKUs. So you have a couple of choices with regards to cleansers. You have 1 toner, you have 1 exfoliant, 1 moisturizer, 1 eye serum, 1 face serum, 1 face extract for those people that are dry, and 1 mask. It also contains the SPF. That Biotints line also contains the organic SPF 30, which can be utilized with any of the other systems we have. Below the green, we have the Bioscience line, which is our classic Nelly brand. We have many different SKUs available in there, so treating many different components of skin. This is where you would find the protocols and conditions like rosacea, anti-aging as well, that would deal more with other issues with skin types like oily skin, dry skin, sensitive skin. The right-hand side on the bottom, the biomedical line, is the acne line. Another simple set of SKUs, but this is the first certified medical organic acne line in the world. And in the professional products, it is the first certified chemical peels available to the marketplace, where you have salicylic acid derived from willow bark, and you have an alpha hydroxy acid as well. And above that, we have the Biofem, which is the organic certified female hygiene line with nice, simple protocols to implement if you're doing any sort of depilation or IPL hair reduction, especially within the bikini area. And this would be significant because you're encouraging your clients not only with better hygiene, but better balance. And the whole conversation there, especially with our female clients, is why it's important to address what's going on internally, so you are getting better results externally. So we want to encourage balance with all of our clients. If you have more questions, feel free to contact us through info@derme.ca. And I thank you for your time today. Please follow through by cross-referencing some of the other videos that we have posted on our YouTube channel, and I look forward to seeing you on our next conversation. Enjoy.